a few years ago when I was working as an ICU nurse. I was incredibly exhausted. I was burned out. And honestly, I was questioning whether I belonged in veterinary medicine at all at this point. I then met Banjo, who was the sweetest little pitty lab mix. He was 8 years old, and he came to us after weeks of basically unexplained illness with his primary care. When he presented to us, he had severe swelling in his back legs, and his referring veterinarian had already tried everything they could. So they referred him to us for a CT scan, which showed extensive disease in his lungs. And when he arrived, he was in respiratory distress. He started having bruising spontaneously and struggling to stay stable. From the moment he was admitted, Banjo required every ounce of critical care nursing that myself and the team I was working with at the time could give. It included oxygen therapy, central and peripheral line placement, constant monitoring for bleeding and perfusion changes, and continuous reassessment. I found myself at his side for hours, advocating for him, asking questions, thinking through every decision. Is this the right treatment? Are we doing what's right for him? Are we doing what's right for the clients? What are the risks associated with everything we have going on? He had bleeding issues, but yet we needed to place a central line to be able to administer all of those medications. So it was really weighing the cost versus the risk of that situation. When Banjo ended up needing a blood transfusion, our hospital didn't yet have an active donor program, and getting blood was incredibly hard. So I did what probably any veterinary nurse would do for a patient that they really believed in, and I brought my own dog in, Zeke, to serve as his blood donor. Zeke's blood gave Banjo the strength to make it to Virginia Tech for more advanced diagnostics and care. Unfortunately, a few days later, I got the news that Banjo had been humanely euthanized. His final diagnosis on necropsy was histiocytic sarcoma. And even though we couldn't save him, Banjo changed something in me. He reminded me why I became a veterinary nurse in the first place, which was to advocate, to comfort, and to give every patient the best possible care, no matter the outcome. Banjo's story wasn't one of defeat for me. To this day, it's a story about vigilance, teamwork, and compassion, about using every skill we have to give our patients dignity, relief, and love in their hardest moments.